I bring you the very warm greetings of His Excellency President Muhammadu Buhari, who keeps asking me how far we have gone with the reform process, to which I've always responded, it is ongoing. I think he has now realized that ongoing doesn't mean very much, and that we have to actually have some specifics. Health reform has always been a front-burner issue for many administrations before us, and we heard from the very comprehensive presentation by Dr. Azodo and also from the consultation paper that is almost cyclical. There have been several health reform initiatives, and this administration also has taken this as a rather serious matter that ought to be addressed fully. And the reasons are quite obvious. Our public health indices have, over the years, been poor. Existing facilities can hardly cope with the current population. The population continues to grow at between 2.4 to 2.5% annually, making it difficult for existing facilities to cope. We are told that by the experts that we have a hybrid disease pattern with high occurrence of both communicable and non-communicable disease. Most medical expenses are paid out of pocket, and of course, we're told that the out-of-pocket expenditure index is about 70. The result is that illness is not merely a physical or a physically debilitating event. It can also cause financial ruin. Our systems, both at federal, state, and public hospitals, have generally been adjusted, inefficient, and burdensome. And it's estimated that we require between $4 billion per annum, that's US dollars, to about $4.5 billion, to be able to achieve universal health coverage. But with our annual population growth rate, that figure can only go higher. It's also evident that we cannot, by budget alone or by compulsory spend, fund healthcare. And that, I think, has been shown to us, even from the presentations today, that that is well nigh impossible. There's also the problem of inadequate medical and paramedical personnel, an issue which becomes even more noticeable as you move from the urban to the rural areas. Some of the suggestions we've heard already suggest ways of trying to make up for these numbers, or these deficient numbers. And in recent months, doctor-to-patient ratios have fallen even more precipitously. It's on account of brain drain. Previous attempts have been made to improve our healthcare system, and we've heard quite a few of that already. But implementation, as we've heard also, has been incomplete, non-systemic, sometimes haphazard. And in fact, sometimes the records of previous attempts have been very kept. So you'll find that even in trying to build on previous reform, that the problem acquiring information on previous attempts is a very difficult one, which should not be the case ordinarily. I mean, I think Dr. Azodo suggested something she described as institutionalization. And I think that, and that is correct. I think that just as a matter of policy, every reform effort ought to be well documented and ought to be made available across the public service, and even made available on public websites and other public portals. So I think that this particular effort is one that we're going to keep the public very well informed of, and we're going to keep it on public portals as well. So that anybody who wants to understand ongoing research doesn't have to go looking in the Ministry of Health, the Federal Ministry of Health or elsewhere. It ought to be available publicly so that doing research, or those who are just interested can not only know, but participate in the process. An important point to bear in mind is the fact that a national health reform initiative is not the same as a federal government health reform initiative. And I think this point has been very made today. The states, according to our constitution, have responsibility for primary and secondary healthcare and can participate in tertiary healthcare as well. So any reform without the full participation of the states, of course, will fall short of a national health reform effort. So this is why it's so important that the states are involved at every stage. And I'll talk very briefly about that in a moment. So this generally was the state of play in the health sector when on September 6, 2021, the President inaugurated the Presidential Health Reform Committee, and I was given the privilege of chairing the committee of 29 very distinguished members. The committee was to be guided by the following terms of reference. The first, development of a health sector reform program for Nigeria in close collaboration with state governments, with the FCT administration, and taking into cognizance the diagnostic report developed by Vesta Healthcare Partners, the review report of the Federal Ministry of Health, and the advisory committee, and other health reform proposals that may have been submitted or may be submitted to the committee. So there's a wide range of consultative papers and reform efforts that we're supposed to look at. Second is the review of all health reforms adopted in the past 2 decades and factoring in the lessons learned in the development of the new health sector reform program. The third is to chart out a health system that best meets the needs of Nigerians in the 21st century, with special emphasis on strengthening primary health care, improving access to health insurance, and establishing a platform that enables the country to better respond to future pandemics. The fourth is to make any other recommendation to the government as may be considered appropriate towards improving healthcare delivery in Nigeria. I think the mandate writ large is to address the question of universal health coverage. And this remains the key objective of the reform process, universal health coverage. And frankly, I think that reform is always, especially fundamental reform of any system, is always different from several changes that are made in that system. There must be an overarching objective. There must be a vision. There must be some clarity as to what we expect to see in any particular reform. The healthcare reform, there must be a vision. There must be some clarity as to what we expect to see overall. And I'm not talking of the individual components. There are so many important things that are done. Health insurance is one. Even just setting up an essential drugs list, all sorts of things are important. But the overarching objective of a reform must be clear. Where is the reform headed? In the United Kingdom, for instance, they have a national health service, an NHIS service. Now, the NHIS is the ultimate objective of their reform. In the US, they don't have a similar system, but they try to do something with the Affordable Care Act to bring in as many people as possible into the healthcare system, at least to be able to benefit from some kind of free healthcare system. I think ultimately, what most societies hope to do is provide their people with either free or affordable and good healthcare. So there must be something that we're looking at. Of course, the critical objectives subject matter of the reform. In this particular case, health insurance, primary health care, and pandemic preparedness are very, very important. We must keep in mind what the ultimate objective is. However, it's worthwhile to note that government, the federal government of Nigeria, has made some significant efforts to lay some important building blocks for reform, even in the course of the life of this administration. In 2018, the President signed the bill establishing the Nigeria Center for Disease Control, the NCDC, which enabled the agency to respond to the challenges of public health emergencies and enhance Nigeria's preparedness to respond to the COVID-19 pandemic in particular, and several other outbreaks of diseases that we have seen in our country. May 24th this year, the President signed into law the National Health Insurance Authority Act 2022. This new act is an important milestone for health finance in Nigeria. And I think that this is fundamental to whatever reform that we plan to do. Health financing is fundamental, which is why I think the NHIA Act is a fundamental one, because it addresses the chief concern around universal health coverage. I think that it will mitigate the current difficulties of out-of-pocket expenses. To create a virtuous cycle, it means that more money will be available for medical personnel and for hospital facilities and resources. Ultimately, health insurance will accelerate our journey to universal health coverage through health insurance for all categories of Nigerians by a mandatory mechanism in collaboration with state health insurance agencies. I understand that the National Health Insurance Summit is being planned to continue the process of ensuring full implementation of the Act. In March of this year, the Primary Healthcare Summit took place. This was organized by the Federal Ministry of Health and the National Primary Healthcare Development Agency towards reimagining the primary healthcare system in Nigeria. And a case was made there, a very important one, for private partnerships or private sector partnerships to complement the ongoing improvements in primary healthcare infrastructure, and to also support their making more available health commodities, and also, of course, to support the health workforce. I think that the primary healthcare component of this reform is also a very important one. And just before we came in here, I was having a short discussion with the Honourable Minister of Health as to why we need to do something very critical about our primary health reform. And the truth is that for a population this size, we really cannot ignore primary health reform. We must find a way, or primary health care, we must find a way of strengthening that. And of course, there's so many suggestions, and I'm sure so much will also be said today. At the subnational level, we've also seen a lot of the work that the governors have been doing. And we must commend the recent launching of the Primary Healthcare Leadership Challenge Fund, which was launched by the governors, the 36 governors. And it's a commitment by the governors to elevate primary health care higher on their agendas. All of these events and other points of progress, we hope will coalesce into one central program, which is the objective of this particular reform effort. In the past few months, the Secretariat of the committee has been working in conjunction with our various partners to develop a consultation paper. We've seen that paper, we've heard the paper, and I hope all of us have copies of it. It's expected, of course, to guide and focus our discussion. And this committee includes experts from the Ministry of Health, from VESTA, consultants, Bill and Melinda Gates Foundation, WHO, the World Bank, the FCDO, the IFC, Global Fund, the AFNET, DPRC, which is the research arm of the NIPS, and we also have consultants from PricewaterhouseCoopers. A team, very wide-ranging specialists as well. The overarching principle of this process has been inclusivity, and I think this point has been made repeatedly today. And this is reflected in the membership of the committee, which includes representation from the states, professional healthcare bodies, private sector, distinguished medical academicians, etc. And you'll also notice that we also approved the co-option of additional MDAs and also sub-national representation, facilitated by the Nigeria Governors Forum and the Commissioners of Health Forum, NGOs as well as individuals with experience in the business of healthcare. Indeed, if there is anything we learned from the COVID-19 pandemic, and especially its aftermath, is that healthcare, especially public health emergencies, cannot but have a multidisciplinary and multi-sector approach. In the result, serious health reform must have the same multi-sectoral approach, which is why we have Ministry of Agriculture, Ministry of Environment, very well represented today in all of our deliberations, and of course, we're very actively involved in the process, as well as several other ministries. I must particularly commend state governors who, through the National Economic Council and the Governors Forum, have worked together with the federal government on healthcare and healthcare reform. Every month at our meetings, the National Economic Council meetings, we have a presentation on public health, either on COVID, some of the public health challenges and issues. And we also have a department that devoted to human capital development, education and healthcare in particular. So they've been very much a part of the advocacy for national health reform, and very much a part of that, of the movement towards national health reform. I think bearing in mind the difficulties, and this has been pointed out very eloquently, the difficulties of a national health where you have states, components as well as the federal government. I think we've done very well indeed. The state governments have done very well indeed. I have no doubt that we have the right caliber of people on this committee and who will be working through this reform process to address the myriad challenges of the health sector. I believe that everyone has received most of the material, including, I hope, the recommendations and the memoranda that have been submitted, or at least the summaries of the memoranda that have been submitted. And I hope that we will read this documentation. It's a lot of documentation. I know that many people would rather listen to some of the comments, but I hope that you read them just so that our contributions at this level will be as informed as possible. This retreat will be the first opportunity for the committee to meet in person, especially for deep dives within the thematic areas and the subcommittees. And I expect that within the next 2 days, at the very least, we will at least define a trajectory for the future of the proposed recommendations for reform. I hope the draft document will be ready by January, the end of January. I hope we'll be able to have a draft document ready. But the important thing is depth. The important thing is how much work we're able to put all of this. And I hope that because we have there's a lot of groundwork that we've done through the past few months, we'll at least be able to focus on the issues that have been highlighted. I must say that reforms can be very complex indeed. I've been involved in quite a few, as I'm sure some here have been. And the lessons are that there are no silver bullets and no perfect approaches to reforms. And this is especially true in huge areas like healthcare reform. As we've seen, previous efforts already have shown us that you simply cannot have a silver bullet. But we must take into account all the previous efforts. These are some of the lessons we've learned, that previous efforts must be built on. You may have several small, and you also have several small and local reforms going on at different times. And even while this, you cannot stop a state from doing something about its healthcare system. So it's a very dynamic process, and there are many moving parts. And we've got to bear that in mind so that when we adopt a flexible approach that is able to take all of this into account. All we are required to do, in my own opinion, is to at least ensure that we set broad parameters and a vision which will enable us to track and incorporate other reform initiatives. And we must ensure that we have the right people around the table, which I'm sure that we already have, given those who are here today. And that there is wide-ranging consultation, and that all views are properly considered, and that we keep our vision very clear through the process, and we develop a robust and viable implementation process. So let me, as I close, mention for commendation, in particular, our development partners. I want to thank them very much for the commitment of their time and resources. It's obvious that you saw the importance of this particular effort, and they've supported us to the fullest by actively participating in the series of activities which have led to this particular day. And they've supported financially and morally in every possible way. I must also commend all the members of the Presidential Health Reform Committee and our Secretariat for answering the call to service, for their hard work, also their dedication and commitment to this process. So while thanking you all for making the time for this, I hope that our deliberations today and tomorrow will yield sorts of results that will benefit of our people. Thank you very much.